We've always thought that physiotherapy is something that comes into play whenever there is an injury or physical condition that needs to be treated. But
Yeah.
what if physiotherapy plays a much bigger role in women's health? Think about it. During menstrual pain, childbirth, and menopause, women experiences physical changes and challenges, but we are simply taught to endure until it becomes unbearable. Do we really have to? What if these experiences can simply be managed with the right knowledge? Where does a physiotherapist comes in? Welcome to another episode of the Speak With Her podcast. My name is Ola Miriam. You can call me Miro the Talker, and I am excited to be the host on today's episode titled Beyond the Clinic: Physiotherapy's Role in Women's Health Across Every Life Stage. Is this your first time tuning in? This is a space where we invite women from diverse fields and professions to inspire, empower, and educate the next generation, especially young girls who aspire to make a difference in today's world. And in the studio today, we have a truly exceptional guest speaker, a healthcare professional who is there to help us understand the role of physiotherapy in women's health across every life stage. Ladies and gentlemen, join me in welcoming the incredible Ma'am Miriam Jibril. It's a pleasure to have you here with us, ma'am.
Thank you so much, Mariam. Thank you so much. I'm so glad to be here. I'm so privileged to have been invited to your podcast to come and share my experience on women's health. Thank you so much for inviting me.
Thank you so much, and it's a pleasure having you here with us, ma'am. So we'll be expecting to learn more from you as regards to this topic. So before we dive into the conversation, can you briefly introduce yourself, ma'am?
Okay, so my name is Mariam Jibril. I'm currently an intern physiotherapist in Lagos University Teaching Hospital. I finished from Lagos University Teaching Hospital, College of Medicine, University of Lagos. I am a women's health advocate, a UI UX designer, and yeah, that's basically it. I love
Okay.
women, so I'm a women's health advocate.
Thanks for joining us. You're welcome to the podcast. So we know that you are a physiotherapist and you've come across different patients, especially women. So was there any moments with a patient or in your home body when you first realized physiotherapy wasn't just about movement, but about a woman reclaiming her power over her own life? We all know that the normal definition of a physiotherapy, oh, is somebody is a professional that will treat wound and injury or any physical condition that needs to be treated. But is there more to this? Has there been any moments when you felt like, oh, this is more than just movement? It's about a woman reclaiming her power over her own life.
Yeah. So from the question that you asked, I don't think that there was one particular moment for me. It was more of a gradual realization coming to learn about women's health physiotherapy. So was when I started learning physiotherapy as a course, I got to understand that physiotherapy just is way beyond the movement of a joint, movement of a muscle, or helping somebody to regain their movement. There's a psychological aspect that is attached to physiotherapy. Understanding that movement helps somebody in their actual life. For example, I'm going to use an example now. So imagine that a woman has just had a baby and the pregnancy and childbirth have put a lot of stress on that environment in our uterus where the child is growing or has grown. So in that area, you know that there are muscles, there are joints, there are tissues there, and they cannot be the same. They don't have the same integrity as to like before the pregnancy and after the pregnancy. Something would have definitely changed. So like after giving birth, let's say that she's feeling like sort of like heaviness around her pelvis region. Maybe she's also noticed that like a bulging sensation in her vagina area. And then she may start to experience symptoms that may start indicating a pelvic organ prolapse. Now, the diagnosis of what is wrong with her is not just the most important thing. What's the most important thing is what the diagnosis is taking away from her life. let's say that the things that she was able to do before and then that she's not able to do it now anymore. For example, she's not able to, after childbirth, after a while, she's not able to walk for like long distance. And whenever she walks for a long distance, she's feeling uncomfortable with walking. And then maybe she's the kind of person that usually exercised before, but now she's not able to exercise. And then she just feels that her body is not hers anymore. And then maybe sometimes she's trying to lift a child and her body is just very uncomfortable in lifting the child. She's struggling to stand, and then even going back to work is difficult for her. Then she starts to maybe experience some activities. She's not able to do like what she would normally do on a normal, like a social activity, maybe go out with her friends or even be intimate with her husband. Then gradually she's starting to think that this physical problem is starting to affect her confidence, because the reality is that the things that we do beyond being a woman, the things that we do on a normal basis is what we enjoy doing. Is part of our identity. It's what makes us human, right? Beyond childbirth. And these things that are happening to her is starting to affect her confidence, her relationship, her work, her role as a mother, because now she's not even able to carry that child properly. Now, this is the perspective, this is the area, this is the point where physiotherapy comes in for her. She can report to a physiotherapy, a pelvic health physiotherapist. They will do a proper assessment and management for her as part of the care for her, because what she's experiencing is very related to women's health problem, her pelvic floor problem and all of that. So depending on her symptoms, that will decide the treatment routine that they're going to do for her. The assessment is going to help the physiotherapist to be able to tailor a treatment routine that would help her to gradually return to the activities that she would normally do. The treatment routine is mostly exercises and maybe breathing exercises and all of that. But the most important thing as part of the assessment that they will do for her is to understand her functional limitation. I'm going to break down the functional limitation. What has she been able to do before childbirth that she's no longer able to do now? That's her functional limitation. The things that she would love to continue, but she's not able to do at the moment. So that they're going to the physiotherapist is going to tailor the treatment towards that. So being able to walk like normal walking, it may sound silly, but it's not just about walking. To be able to go to work, you need to walk, right? So being able to exercise and feeling strong and feeling confident in yourself, being able to lift your child and experiencing life as it should be. We should not give opportunities to health conditions to strip that away from us. So for me, women's health therapy is more about connecting your body to the life that you love to live. That's why I want women to understand that they don't have to be embarrassed about anything that they're going through at the moment or silently endure, as the society will say. Is it only you? Is this your first time of giving birth? This is her fifth time and she's not feeling comfortable. I don't think that anybody should endure that kind of thing. So if something is affecting their mobility, their ability to move, to exercise, to care for their family, something that they would normally do that will give them fulfillment, they should talk to a healthcare profession. So that's my view on that question. I'm sorry that I took so much time.
The second question I would like to ask on this postpartum pain, depression, trauma, and all of that, menopause as well. So, in that line, can you walk us through a real patient story, a story of a patient that you probably have witnessed where pushing through actually made things even worse? And what do you think? What do you wish she should have known sooner?
Okay. So there's kind of like a protocol in healthcare with patient confidentiality. Okay. So there's kind of like a protocol with keeping patient history and details confidential. So if I'm going to tell that story, I'm going to relay it in like a third person in a way that I don't have to like tell the real patient story.
Yes,
But
please,
can
you
still
can
tell the
do that.
story of patient. Yeah. All right. Thank you for understanding. So back to that
Yeah.
question. The thing is that enduring pain in a way, when I was thinking about that, when you mentioned it, I kind of thought that enduring pain in a way is like is a societal language that is very unspoken. Sometimes it can be as little as a eye contact. That's verbally spoken, and you just understand that that's what that person is trying to say. Everybody just expects that you understand. Everybody expects that you endure pain. Is a norms. So when you're trying to break the norm and you're trying to do something that is not the norms in society, it start to feel like you are overdoing things and all of that. So now I'm going to mention a condition. I'm going to relate it to the question that you asked. So one condition that really comes to my mind when I think about how women are taught to endure pain and all that is endometriosis. Imagine that a woman gets her period every month, and then she has cramps, she has pain, low back pain, and all of that. And then everybody around her is saying that maybe she just tells her mom or she tells her aunt or any female around that she's feeling that kind of pain. And then the next thing they tell her is, oh, that's normal. That's normal. You're not the first person that will, do the period and all of that. Then she'll just tell her, okay, take painkillers, take paracetamol, you'll be fine. Take Felvin, you'll be fine, and all of that. But then she still feels like there's something that is different about her pain. And then the cramp usually have, like, it's just severe for her. She has maybe severe pelvic pain, she has a low back pain, and if she's sexually active, she has pain during and after sex. And then she has like very heavy period, prolonged period, pain that is severe to the extent that it interferes with our daily activities. Some people have pain, not just the lower abdomen pain, the kind of pain that is even radiating down their legs. That's how severe that pain is. But even after her sharing what she's going through with people around, they're still telling her that, oh, that's normal. Don't worry, it will go. Don't worry, just endure it. And then she now starts thinking to herself, maybe I'm not strong enough. Maybe I'm just exaggerating. Maybe I should just take painkiller, as they say. So that's her pushing through what she's going through. Then gradually, eventually, you get to a state that if she's a student, she's not able to concentrate in school. If she's a social kind of person, she start missing activities. She's not able to go out with her friends. If she's physically active, like exercise, she exercises a lot. She's not able to do that anymore. She's canceling plans with her friends. She now starts to build a life around what she's going through, her pain and her period and all of that. Then what I really want people to understand is that the kind of pain that repeatedly stops you from living your normal life should not be dismissed as other people are experiencing. So what's the big deal? Do you understand that kind of thing? So eventually, let's say she gets medical help, she get assessed. And the doctor now said, okay, let's do a pelvic ultrasound. Let's check your uterus. Let's check your organs. And then let's say that the imaging now shows signs of endometriosis. She's now eventually diagnosed with endometriosis. So imagine that at that point, she kind of feel like a relief. So she's feeling the pain, but there's kind of a relief, the kind of relief that says that now I can put a name to what I'm feeling at the moment. Now she has stopped pushing through. Now she understands what is going on in her body. There's an explanation for what she's experiencing. So there's going to be kind of a frustration that says that, oh, she has spent so much time thinking that is normal. But it's not just her, it's people that are around her that are making her feel like she's doing too much, she's exaggerating. That's where the society has a role to play. We unintentionally, amongst ourselves, sometimes we do it and we don't even know that we are doing it. We unintentionally just teach women that pain is something that they should tolerate, they should endure. Oh, don't worry, to go, it's just a period. You tell a woman that, oh, you've had a baby. So of course you're going to have pain and take paracetamol to go. But resilience, I think, is not something that you should. Resilience is not suffering. People see resilience as, oh, is a good character, is a good habit. Don't worry, you get over it and all of that. But it should not mean suffering in silence. So what I wish that women would know sooner, what I wish that a woman would have known sooner is that I wish that I wish that a woman will not have to prove herself that she's strong to everybody, or that she's strong enough to endure that pain before asking for help. If, again, I had mentioned earlier, if a pain is severe to the extent that it stops you from doing what you would normally do, like going to school, having sex, going to work, exercising, sleeping, and socializing, and doing all the things that are important to you, don't assume that you just have to endure it. As long as it stops you from doing the things that you normally do every day, your pain deserves to be listened to be attended to. Sometimes seeking help very early, it doesn't mean that you are weak. It just means that you are paying attention to your body, that you are taking your body seriously. Yeah, so that's it.
Absolutely. Wow. Wow. That was very explicit, explanatory enough. I mean, a whole lot of one of the things I believe influence this question is we hear a lot of these things. Like you said, their societal um or what's it called now, that is just out there. A lot of people say push through, you're not strong, and they start making you feel like because you cannot take some level of pain or you can't endure some level of hardship and all, you feel that you are weak, you are this and that. And because of that belief system that is out there, people fall into the trap of pushing through and even end up getting stuck, getting worse, or even the to the height of it, saying maybe dying in the process. So I believe this would is has gone ahead to talk to many women, ladies that will be listening to this podcast to know that it is when you, because everybody have their own threshold of how far or how much they can take in. When you know that you are hitting your threshold, please give it a break, seek counsel, talk to people that are professionals in this field so that you can know what or what not to do. Do not copy someone. Do not feel because this person has done it or this person has said this, I also, you're not obligated to follow through with that. So thank you once again for that, ma'am. Okay, so the second question,
You're welcome.
what is a woman's health issue physiotherapy? Um, what can it treat that most women don't know is treatable, and how do you personally learn about that?
In that question, I would like to replace the word treat with manage, and I'm going to explain why. Well, I like to say that physiotherapy is a very realistic profession. When you come with a condition, I know that sometimes the patient would like to know, oh, how soon can I walk? Or how soon will this pain stop? We can give a time frame, but we're not saying that you would go back to exactly how you were before that pain came. So most times we like to say manage. We manage conditions. We don't treat conditions. So in a way, treatment comes under the management, but we don't like to use the word treat because, oh, I personally don't like. I don't want to speak for other professionals. I personally like to use the word manage so that you don't raise patient expectations in a way. Now, the women's health issue that women don't know that physiotherapy can treat that is related to women's health is urinary incontinence. So when I say urinary incontinence, I'm talking about how it's as simple as a woman coughing or sneezing and then she's leaking urine, like urine is just coming out. She's exercising, something that puts pressure on her abdomen, and then she's leaking urine. The funny thing is that a number of women go through this, but they don't come out to say. And I feel like the society has a role to play because the women are scared. The society will stigmatize them. Oh, you're leaking urine. Oh, you're doing this and all of that. And then the supervisor, oh, you're smelling, or you're not normal, or the kind of comments that they give, they force you in a way to keep these things to yourself. Probably why a lot of women don't report to physiotherapy or to the hospital to come and report these conditions. So a lot of women experience this particular condition, particularly women that, you've had pregnancies, after childbirth. I know that for women's health, most times it's just pregnancy, childbirth. Even sometimes without pregnancy and childbirth, if a woman has had a surgery that involves the incision of that area, it can actually put a lot of stress in that area. And then the structures around there, they're not as strong as before and all of that. So surgeries and other things can actually affect the woman's pelvic floor. Now, Some women just accepted it as, oh, is normal. Let's say that the first person that you try to tell after experiencing it, the person makes a statement like, oh, don't worry, it's normal for it to happen after childbirth. That's not normal. If somebody sneezes, they leak urine. If the person laughs, they leak urine. That's not a normal thing. That's not a normal thing to happen to a woman. So eventually they stop doing some things that they enjoy, and then they're afraid that they can leak outside, like when they're outside. So the thing that's very common around all these issues is that they start to plan their life around. That's not what it's supposed to be. You start to plan your life around the condition that you're feeling, which is very wrong. And that's why this conversation, I think, is very, very important. Is not Urinary leakage is not something that a woman should automatically assume that she has to live with because she has had a baby, or because she has had a surgery, or because she's getting older. It's something that deserves attention. It deserves an assessment by a healthcare professional. So a pelvic health physiotherapist can actually assess what is contributing to the problem and to help the person to develop a management plan. So something that is very beautiful about the healthcare system is that we work like a multidisciplinary approach. The most important person in the team, in the healthcare team, is the patient. So it's not just the physiotherapist that will see the person. We want to know if the urinary leakage is connected to the brain function. So a neurologist may come in, a family medicine person may come in. It can even be something that has to do with the psychology. A clinical psychologist can come in. So it's necessarily not only the physiotherapy that is going to manage the condition. Now we need to, particularly for physiotherapy, because that's my own field, we need to assess the pelvic floor properly to see what exactly is causing it. We want to check, are the muscles tight, are the muscles weak. So the treatment can include something like a pelvic floor exercises. So when I say pelvic floor, let me break it down for my audience. The pelvic floor are like a band of muscles that are surrounding all these organs, the bladder, where the urine is coming out from, and all these, the place that you carry a baby, the uterus and everything, the muscles surrounding that area are the pelvic floor muscles. When something affects the quality or the strength, the integrity of these muscles, a woman can develop this kind of issues. So the pelvic health physiotherapist can help the woman to come up with exercises or techniques. It can be as simple as a breathing technique, helping her to manage the condition, gradually helping her to return to the activities that the woman have been avoiding or that she normally do before the urinary incontinence started. But that's like the end goal, helping her to return back to the condition or the state of health that she was in. It may not be 100% fine, but it's something close, and I'm sure she's going to be happy about that. Then personally, I didn't learn about I've not experienced urinary incontinence by myself, but I learned it through my exposure to women's health, physiotherapy, and all of that. Yeah. So one thing I also like to point out is that one thing that is very beautiful about physiotherapy is the the goal of helping that patient to return back to how they were before they started to have that condition. And I'm going to give an example. I think a week ago there was a patient that she came in with she was walking in, and then I noticed that she was limping in a way. And then I had a conversation with her, I did an assessment and all of that. And we started with the exercises and stretches and everything that I know that was going to help her. And one of her complaints that thank God I paid attention to, was that something as simple as tying a wrapper by herself. It may sound silly to us. Tying the wrapper, like she had a problem with her shoulder. Tying the wrapper by herself was difficult for her. By the end of the treatment session, she was able to tie that wrapper by herself. And you could see in her face that she was so excited, she was elated. Now, I'm not saying that we have addressed the problem to the root cause, but being able to do something that you were not able to do few hours ago is fulfilling. And I feel like that's my own goal. It's fulfilling for me. I was so happy and she was so happy. And then that was it. Yeah. Anybody Hello.
Yes, please. I was muted.
Okay, okay.
Apologies. Okay, so wow, amazing. A lot has been said, and I wouldn't want to go ahead to repeat what you have said, but I'm very, very sure that lessons have been said and learnt from those words of wisdom, and we are grateful that you can dip into the well of such knowledge that you have to share with other women, ladies that are out there looking to get to know this. Um,
Okay, so thank you so much for the responses so far. We all know that you work on a design team shaping a whole initiative. What's that moment in that work where you had to fight to get women's bodies taken seriously in a room that wasn't built with them in mind? For example, we know that the situation sometimes doesn't allow us to get into the room. They don't even build us in mind. So it's just as if you are not being invited here, but you actually work in that design team, shaping a whole initiative. So what is that moment in that work where you have to realize, like, okay, oh, we have to get women's body in here also seriously. So have there been any moments like that before?
Okay. So the design theme for the initiative is a physio movement, and for women by women in a way. I'm going to explain. So we have co-founders. Co-founders are majorly women. We have some men on the team. We have team leads. All team leads are women. We have community members. Majority of the community members are women. We have few male in the team. And honestly, I'm just going to say that I've not had a moment where I've had to fight to get women's body to be taken seriously. And that's something I'm very, very, very grateful for. My experience with the design team in HPM has been very, very good. And I'm not going to lie about it. Um, a lot of us are women on the team. So I've not had to fight to get women's body to be taken seriously. Everybody on the team take we take women's bodies seriously, and the male and the female, everybody. In fact, sometimes when we have webinars, the some of the male co-founders are even the one that spearhead the webinars. Talk about women's health, talk about the myths surrounding women's health. Sometimes they talk about um the they are males, so they talk about males' perspective of the women and how they are trying to correct it from their own end. So one of our very strong goals is that we put we put out whatever we put out has it just reflects that we have women in mind, whether it's a webinar, whether it's an educational post, a community meeting, even down to the design. Because I'm in the design team, down to the design. When you look at the design, we are asking ourselves that this design, does it actually speak to women? Does it represent a woman's experience? Does it make them feel supported? And it's not just about, oh, the design is visually appealing. It goes beyond that. When a woman says, what is it communicating to a woman? We don't want to create content or these great designs that shames women or make women feel inadequate or tell women that their experiences are not valid. We want our community to be supportive, educational, and empowering, something that communicates women, something that make women feel like, oh, there's a particular initiative that have us in mind. Yeah, so that's what we are for. And then one thing I've really appreciated about working with my team is that male, female, everybody, we are contributing towards the same goal. There has never really been a conflict or something that we've had to fight for women's need to be recognized. For me, designing for women, but not just designing about women, it has to be the perspective. What will a woman feel when she sees this design? Yeah, so we design with the woman's experience and needs, the reality of things in mind. So we have a team of women. We have male on the design team as well, and we always ensure that whenever we do a design, it goes through. There's something like a quality control. It goes through people's tables, and they have to approve it. That okay. this is suitable for a woman to read. A woman is going to she's going to feel happy, she's going to feel seen and appreciated when she sees this design. Yeah, so that's it. I've not had to fight anybody in any role.
Okay, thank you so very much for that response. And I'm glad that the designs actually puts movement to body in mind. Like they are really okay. Let me ask this. What's the mission of the designs? What's your vision? Can you share your vision with us?
Okay, so I'm going to be very practical. In, let's say, like a month, we have like a content calendar that we work with. In a month, so the content calendar usually involves, like, I think July was like fibroid awareness month. So we don't just design just anything that we feel like, oh, okay, women's health condition. Fibroid awareness month. So it means that women that have fibroid, that's a time to make them feel seen and to not make them feel neglected or stigmatized. And that's the role that we have decided to play. So we do everything around Fibroid Awareness Month. We put out designs that educate the woman about what is already going on in her body. Visually appealing designs, but it's also very informative. We, sometimes we do outreaches and we invite women to talk about their body, and sometimes we just do like small activities and all of that. So we want to ensure that we're not just releasing designs, we are doing designs that communicate with the women gender, that make them feel seen, that make them feel like, okay, even in this world that is chaotic and everybody is behaving like they don't care, or everybody is stigmatizing and discriminating, there's still a group of people somewhere that is paying attention to what is going on in a body. And yeah, that's just what it is. Making women feel seen with the kind of designs that we put out. Yeah.
Thank you so much, and well done on the good work. Because if not for the design team, I feel like most people, most women especially, wouldn't even realize that they are suffering inside and will not know how to reclaim their power. And I believe that through the design team, they will be able to find a solution to their problem as well. Go to a teenage girl. I believe that this podcast, and I know that this is specifically for young girls and young women. And I know that a young girl is definitely listening to this video as well. So this question is for her. If a teenage girl or young woman listening right now has never seen a physiotherapist before, and does she even think she needs one? Okay, what is that one story from your career that you'd like to tell her to change in her mind?
Okay. So if there's a teenage girl or a young woman that is currently listening to me, one thing I would like to tell her is that she should not wait for something to become unbearable. It does not have to become severe before she starts to learn about her body. So notice that I didn't say she has to reach out to a healthcare profession. It's learn about the body. Something that you don't have knowledge about, you cannot approach it you cannot approach it in a passionate manner. Don't wait for something to become unbearable. Don't wait for it to become very, very severe before you now start to first learn about the body, then you now reach out to a healthcare profession. So there's so much to learn about the female body, honestly. And I'm going to share my experience from when I was in secondary school. My curiosity started when I was really young. When I was in secondary school, I had a step partner, and anytime I had not started mine then, anytime that she was on her period, she would experience severe menstrual cramps. I just knew that anytime that she was on her period, she would cry. She would not be able to move around. No, the way we secondary schools girls have, as at that time, she would not be able to move around. When we are running around, or maybe sporting activities. If she's on a period, she cannot engage in those kind of things. And I'll be wondering that why is her body doing that to her? Why is the woman's body like this? And then I'll be scared in advance for myself that, oh, if I'm on my period, will this be happening to me? I became curious. I wanted to understand what was happening inside the female body. Now, this is driving me back to that question. Yeah, that experience stayed with me. The curiosity stayed with me. Then I got to university, and then we did a course on women's health physiotherapy. And I feel like that was my turning point. That was a turning point for me. It was very pivotal for me. I remember that class, even if I was not paying attention to any other class, I was always paying attention in women's health physiotherapy class, because what is being discussed is what is inside my body. So I needed to understand it properly. We talked about a lot of things like menstruation, pelvic floor, pregnancy, movement, and everything that a woman experiences, right from childhood to adulthood to pregnancy to labor to perimenopause to menopause. Some conditions that are very specific to a woman, osteoporosis and all of that. I think that so the reason I paid attention was, like I said before, it was about me. It was like as the lecturer was talking to me. So if I could speak to a young girl right now, I would actually tell her to learn about her body before her body forces her to learn about it. You don't have to wait for something to happen to you before you learn about your body. You don't have to start experiencing severe pain before you learn about your body. And you don't have to wait till you're struggling with something like you're struggling to move. You don't have to wait till you have a baby. So that means you don't have to wait till you have a baby to learn about your body. You don't have to wait till once something feels very unbearable before you're not curious about your body. So you have to understand things like your menstrual cycle. You have to understand what is normal for you. Because it's until you understand what is normal for you before you start to identify what is abnormal. When you understand what is normal for you, when something abnormal happens to your body, you are able to quickly pick it up and you're able to quickly know that, oh, this is abnormal. I have to speak to somebody. I have to pay attention to the symptoms that are happening to you. If they are unusual, learn about exercise. You want to look good, your posture, even as a woman, your confidence, your pelvic health, and most importantly, you want to learn something that is different enough for you to speak to a healthcare profession. So, women's health physiotherapy, it covers, a wide range of things, and it practically pays attention to a woman from when she's a child to when she's an adult, you know, everything like that. And then when a woman, she doesn't have a problem and all of that, at least she should be aware about her body. So, because when you understand your body, you're able to most likely recognize when something changes. Then you can just tell yourself that I don't think I feel okay, and this is not how my body normally feels like. Yeah. So, and when she understands it like that, when she understands that this thing is not normal, when she talks to somebody and the first person that she talks to is giving her that societal uh the normal response of, oh, it's normal, oh, just endure it. She already has knowledge in her that this is not normal, I do not have to endure it. So she's able to seek help. She's able to continue telling people about it, or she's able to speak to the right person about it that can help her to seek help. So if I have one message that I want to tell the teenage girl today, is that she should not wait until her body is in severe pain, is in a severe condition before she starts to listen to her body, or before she starts to get aware of her body. Yeah, thank you.
So very much for the sharing of knowledge.
You're welcome. Thank you, Elizabeth. Thank you, Mariam. You're doing great work, by the way.
Thank you
Thank
so
you
very
so
much. I
much.
really
It's our pleasure
appreciate your
to have
time today.
you.
Welcome.
At this moment, although I will on this podcast because it's very very interesting. You were able to explain, like, it's very, your explanations, they are detailed, even with real experiences and knowledge. I feel like a young girl, a young woman who has been doubting if she really needs a physiotherapy in her life, now you've been able to watch this video and you've been able to convince and not to confuse yourself that you actually need a physiotherapy during period, childbirth, pregnancy, even if you have everything feel like, oh, you are not feeling well, oh, you need this kind of, you need treatment in some part of your body, and really need to see a healthcare professional. If physiotherapy is the best person to talk to at that moment. So thank you for watching, and remember to subscribe, like this video. This comes to the end of the episode, Beyond the Clinic. Physiotherapy roles in women health across every life stage. Thank you so very much, Ma'am Jubril Mariam, for coming. We truly appreciate your presence here. Thank you so very much, and we love you, ma. So thank
I love you
you
guys.
to our amazing,
Thank you.
thank you to our amazing clothes. Thanks for the support.